Welcome to my video. In this video, we'll be looking at superficial reflexes. What is a reflex? A reflex is an involuntary response to a stimulus by an organ. It is a protective mechanism which involves the sensory receptor afferent pathway, the center efferent pathway, as well as the effector organ. So in this video, I will be demonstrating 5 superficial reflexes, which involves the corneal reflex, conjunctival reflex, corneospinal reflex, plantar reflex, as well as the abdominal reflex. So I will begin with the corneal reflex. So the corneal reflex, I will ask the patient to take off the glasses first. Okay, thank you so much. So I will ask him to look on the other side. Only the pupils should look on the other side. Okay. So from there, I'll ask him to open the eyes. Okay. Okay. So now from here, you can observe the closure of the eyelids shows that the reflex is not exaggerated. It is okay. It is well and dry. So the second one, we are going to go to the conjunctival reflex. The conjunctival reflex actually is just the same as the corneal reflex. In this particular case now, instead of pressing the whisk or cotton in the cornea, we are going to press it in the conjunctive. So as the same, just look on the other side. Okay, observe look on the other side. Then I put on the conjunctive. I also observe the movement of the eyelid, the closure of the eyelid. This one is to show that the conjunctive reflex is not exaggerated. So the other one is the serial reflex. In the serial spinal reflex, in this case, I'm going to pinch the neck area, the skin of the neck. In this case, when I pinch on the neck of the skin, the normal response is the closure of the eyelids. It is going to show us the closure of the eyelids. Okay, so as we can see, only once, we can only do once. There was a closure of the eyelids, which shows that the reflex was not exaggerated. Now we are going to proceed to the abdominal reflex. So as we proceed to the abdominal reflexes, I'm going to ask the patient to show off the abdomen region. So as we can see, in this type of reflex, we've got the upper stroke, the middle stroke, and the lower part of the abdomen where we are supposed to stroke. So in this case, we are going to stroke upward like this. You can see the reflex. Then we can stroke like this. As you stroke, the response is that it's supposed the umbilicals will be moving opposite to the stroking. As you can see from here also. The other side also, as you can see, as I was stroking in this direction, the umbilicus was moving in the same this direction to meet the stroking. So this is all about the abdominal reflex. Now we'll be moving quickly to the plantar reflex. Please, to the plantar reflex. In this case, I will stroke from the lower region to this side. So as I stroke like this, there is a movement. There is a movement like this, and the great toe will be moving in the direction, reflection direction. So the other reflex that we can look at is the last one, which is just the verbal one. It's not necessarily to do it, cremasteric reflex. In this cremasteric reflex, we are, in majority of the cases, we just ask the patient to remove it, mostly for male patient, whereby we ask the patient to remove their clothes, then we strike the medial side of the thigh, upper thigh, then we observe the contraction of the one side of the testicle, which shows the reflex of the superficial. So thank you for watching my video. I hope this video was so informative unto you. Thank you so much.